And now it's time for Onpoint, where we speak to experts to delve deeper into the biggest news stories in the spotlight right now. Of course, with more easing of restrictions, including the lifting of outdoor mask mandates here in the nation, all eyes are at how countries around the world are dealing with their eased measures.
And as liberating as it feels to take our masks off outdoors, many can't help but feel exposed at the same time. And while we discuss these concerns and how the global community needs to prepare for a future resurgence, which experts warn are coming. For this, we connect with Ben Cowling, Chair Professor of Epidemiology at the University of Hong Kong. Very warm welcome to you, Professor. And, well, first off, many parts of the world, they've already started taking off their masks outdoors, and that's something that South Korea is actually starting today on Monday. And, well, how have these countries been faring so far?
I think it makes a lot of sense because we know there's not a lot of COVID transmission outdoors. It's mainly indoors, other than, as you mentioned, maybe the large outdoor gatherings. And so I think it's a very sensible measure. Of course, when you're trying as hard as possible to stop transmission, you want to do everything possible, and an outdoor mask mandate would be part of that. But now the numbers are coming down in South Korea, just as they've come down in other parts of the world. I think it makes a lot of sense to remove that mandate, that requirement. Of course, people can still wear masks outdoors if they want them to.
You know, obviously the easing of the mask mandates come as, a number of countries, most countries are actually seeing fewer COVID-19 case results right now. And this could possibly be, as we talked about before, just so much immunity going on, so many people having been infected with COVID-19. Now, is it safe to say that if you've had Omicron, that you won't have to worry about getting the Omicron variant once again?
Not quite, because there's different sub-variants of Omicron. There's been a lot of BA1 and also BA2 going around in recent months. What we haven't yet seen around the world is BA4, BA5. Those are just starting to appear in Europe. So if those arrive in South Korea in the future, there may be a chance to get infected with those. So that's Omicron, BA4, BA5 maybe. But it will tend to be a much milder infection in people who've got immunity from a previous Omicron infection, whether it's BA1 or BA2. So our immunity is getting stronger and stronger following vaccinations and also following infections. And COVID is posing less of a threat now than it did in the past.
Professor Cowling, South Korea is giving second booster shots to its elderly population, and there have already been countries that have been initiating this. So what does the data look like for them in terms of efficacy?
For very old people, we know that the third dose gave a good boost to their immunity against severe disease particularly, but there was a wearing off of the effect. The effect was tending to wane, to reduce after maybe 3 to 6 months. And so there's a recommendation now in many parts of the world for older people to get their fourth dose. It's like a top up of their protection back up to the high level, maybe for another 3 to 6 months. And one of the questions going forwards is, what about future doses? Will they be every 3 months, every 6 months, every year? I think it's too early to say right now, but certainly for now, a fourth dose can improve protection in the most vulnerable people. We know that's the very old people particularly.
Yeah, it just seems like these new variants or sub-variants are popping up quicker than, new vaccines being developed at this time. But, I mean, what we are seeing, and, the WHO coming out saying that the reason why we're seeing a decline in number of cases just worldwide is because, just the number of testing being done, plummeting, from the number of testing that we've seen before. Now, what are some concerns that come with just less testing being done, other than, of course, the reduced number of cases that we're seeing?
Well, in the coming months and the coming years, I think we need to find better ways to do surveillance on COVID, because we can't rely on enormous numbers of tests being done as they had been in the last 2 years. Otherwise, if we don't have a better way of monitoring infections, it's going to be difficult to say when infections are up or when they're down. In South Korea, it's very clear right now that infections have been coming down for weeks. And that's nothing to do with testing. That's just because of the natural flow of the epidemic. But in the coming months, I'm sure there will be ups and downs in infection numbers around the world. And one of our problems is going to be figuring out exactly what's going in other parts of the world, because at the minute we're relying on case counts rather than a more stable surveillance system. That's something that I think the World Health Organization are going to have to resolve.
And lastly, Dr. Cowling, Dr. Anthony Fauci in the US said last week that America is now mostly out of the full-blown pandemic phase. And what about the rest of the world, though? When can we say that it's mostly out of the woods?
Well, so I think certainly for South Korea, it looks like you're moving out of the pandemic and into the post-pandemic phase, where I think in the coming weeks and the coming months, most of your pandemic restrictions will be relaxed, starting with the outdoor mask mandate, but moving to other restrictions as well. And then in the future, maybe we'll only see restrictions brought back as an emergency measure for a very short period of time. We won't see prolonged use of measures. Sorry. So I think most of the world is moving out of the pandemic phase into the post-pandemic phase. There's only a few areas of the world that are still really trying very hard to stop transmission, including recently Shanghai, of course, and Beijing.
Yeah, I guess we're just kind of hoping that we don't see another massive variant that we saw with the Delta variant last winter. Professor Cowling, as always, thank you very much for connecting with us, and looking forward to talking to you again next week.
Thank you.